This conference will now be recorded.
Okay, welcome everybody. Thanks for joining us. If you don't know me, my name is Jessica, and I am the Community Engagement Coordinator at the Patchogue-Medford Library. Tonight we have a program all about Medicare with Cindy Goldsher. So before we get started, I just have a couple of announcements. If everybody can go ahead and mute themselves, that would be great. So that way we'll only hear Cindy when she talks. If you don't know how to mute yourself, don't worry. I will take care of that for you. If anybody has any kinds of questions, they can go ahead and they can type it in the chat box. If you are on the phone, what I'll do at the end is I will unmute you so that you'll have a chance to ask your questions. So tonight we have Megan from the library with us as well, and Megan will be monitoring the chat box. So if you type anything in the chat box, we'll definitely get it. Also in the chat box, I went ahead and I typed in my email address. So you can reach out to me with feedback about tonight's program. And also if you have any suggestions for future programming, whether it be in-person programming when we're able to do that again or virtual programming, we'd love to hear from you guys. Also, I typed in Cindy's email address in the chat box. So if anybody has any questions for Cindy after the program, you'll be able to reach her that way. We have a couple of upcoming programs that might be of interest to you guys. All of our programs are on our website, pmlib.org. Tomorrow at 10 a.m., we have a creative writing group. On Saturday, we're having a program about worm composting. And on Sunday, we are having a program with an herbalist about boosting your immunity naturally and safely. So those programs are open to all. So we'd love to have you guys join us. Also, I just wanted to remind everybody that the census is going on right now. So if you haven't filled out your census, it's pretty much being done online. But you can also fill out a paper form. And if you have any questions about anything, call us at the library. The library, we're still taking phone calls and we will call you back, or you can email us. The number at the library is 631-654-4700, and we are here for you. So that's enough of me talking. I am going to mute myself in a second, and I'll also turn off my webcam, and I'm going to turn the presentation over to Cindy now. Cindy, it's all you. Thank you.
Hello, everyone. I'm not sure if you can see my screen yet. How's that? Oh,
Yes, yes, we can.
okay. I'm glad you can. I can't. Hang on a second. There we go. All right. Welcome, everyone. I just want to say hello and introduce myself. My name is Cindy Goldsher. What do you want me to hit? Oh, we're here. Hang on one second. I'm having a little technical difficulty. Okay, I'm back. So I just wanted to introduce myself. My name is Cindy Goldsher. I am a New York State licensed agent and broker. I'm also a senior services specialist, and my passion is Medicare. I hope that all of you are finding ways to manage during this difficult time and are staying healthy, and that I wish all of you and your families the best. I want to thank Jessica and Danielle from the library for making this webinar happen. This is my first time doing a webinar for the library, and usually I'm a presenter doing an in-person seminar. So again, I'm kind of learning as you go along, and we have a big topic ahead of us. So let's get started with what we're going to be covering tonight. I'm going to go to my first slide. All right, so the topics today are: what is the Medicare program and who is eligible? What are the 4 parts of Medicare? As well as how do you get your Medicare benefits? Because there are 2 types, there are 2 ways to actually get your Medicare benefits these days, and they're very confusing. We're going to talk about Medicare supplement plans, when you pair them also with a drug program, which is called Part D. We're going to talk about Medicare Advantage plans, and I see I have some spelling errors here. I apologize. We're going to talk about Part D drug stages. We're also going to talk about dual special needs plans. We're going to talk about low income programs, when and how to enroll in different enrollment programs, and how do you go about choosing what's best for you? Because this is really a difficult topic. So if you are confused now, you may be confused later. But I don't want you to feel that you're alone, because this is something that everyone is challenged with. Medicare changes every year, and it's difficult to stay on top of. So I'm here as an advocate to help you, and this is strictly an educational seminar. So here we go. Well, Medicare is a program that started back in 1966. It's a federal program. And the biggest misconception that people have about Medicare was that it was designed to cover everything. Well, the program was designed to provide quality health insurance, not only for seniors age 65 and older, but also for certain categories of citizens and people that are under age 65. So if you're 65 or older and you're a permanent legal resident, you're eligible for Medicare. If you're under 65 and you're receiving Social Security disability for more than 24 months, you are eligible for Medicare. If you're under 65 and you have kidney failure, also known as end-stage renal disease, you're eligible for Medicare. And if you have Lou Gehrig's disease and you're under 65, you're also eligible for Medicare. So you may meet people in the community who are not 65 and have Medicare, and now you know why. So there are 4 parts to Medicare. Part A, and can you see my cursor? There is Part A, which is known as hospital coverage. There's Part B, which is medical. There's Part C, which is known as Medicare Advantage plans. And these plans are provided by private insurance companies and usually include prescription drugs bundled in with them, as well as Part D, which is known as prescription drug plans. All right, let's get started with Part A. Now my screen, Jessica, how do I move my control panel over so I can see the other part of my screen? Just click on it, move it. There we go. Okay. So let's take a look at Part A. Part A, as we discussed, is hospital insurance. And when you look at this chart, you can see that the left column is the length of stay in the hospital, as well as we have skilled nursing under Part A, hospice, and blood. The middle column is what Medicare covers during those periods of stay, as well as what you would pay if you had nothing else other than original Medicare. All right, I want you to keep that in mind for the purposes of this presentation. So when someone goes into the hospital, whether they're in for 1 day or 60 days, there's a $1,408 benefit period deductible that you would be responsible for if you had nothing else. Well, what's a benefit period? I'm going to go back and discuss that. Let's keep going. If someone's hospital stay lasts beyond 60 days and they're confined between 61 and 90, you can see Medicare is going to pick up their expenses after you've met your deductible. However, they now assign a copay per day of $352 per day for each day 61 to 90. Now, there's a running total. That running total is $10,560, which includes the benefit period deductible. If someone's hospitalization lasted beyond 90 days, it does happen. Medicare defines this period as your lifetime reserve days. Most people are not aware you only get this segment once in your lifetime. And here you see the copay, or the cost per day, has now doubled from the period before. It's now $704 per day for each day 91 to 150. And yes, look at that running total. If you were in for 150 days, that running total is $42,240. Beyond 150 days, Medicare runs out. Do you see that in the middle column? Medicare pays nothing for this period. It's all of your responsibility. Let's go back and define what a benefit period is. So a benefit period is, as defined by Medicare, a period when it begins when you go into the hospital and it ends when you've been out for 60 days or more. If you go back into the hospital after that 60th day, you have a whole nother benefit period deductible to meet under original Medicare. Medicare does not cap how many deductibles you are responsible for if you have multiple hospital confinements in a calendar year. That's a big concern. And yes, the time that's spent in a nursing home or rehab does count towards that benefit period. Now let's look at skilled nursing and rehab. And you can see that Medicare does pick up the first 20 days in full. After day 20, here's where they assign a copay to you. Your copay is now $176 a day for each day, 21 through 100. There's a running total for the skilled nursing and rehab. That running total, if you were in for 100 days, is $14,080. That's on top of what you might have accrued in the hospital. So can you see that Medicare clearly does not cap your out-of-pocket expenses, and it clearly doesn't cover everything. Hospice is also considered Part A, and for most part, Medicare covers hospice coverage in full. There are limited copays for prescription drugs. And blood, you can see Medicare will pay 100% after the first 3 pints. You're responsible for the first 3. Okay, let's go to the next slide. Now, most people do not pay a premium for Part A, and that is because they or their spouse worked for 40 quarters or more in their lifetime. 40 quarters is equivalent to 10 years. And if they are receiving Part A for free, that is called premium-free Part A. If they or their spouse did not work long enough and contribute to the payroll Medicare taxes through their payroll, then they have something called premium Part A. Oops, I just lost my screen. There we go. Most people should enroll in Part A when they're first eligible. Some people may want to consider enrolling in Part A if they're still employed and they are contributing to a healthcare spending account. The reason being is if you contribute to your HSA account once you are on Part A, you could be subject to an IRS fine. So it's important to speak to your Human Resources Department about when would be the best time for you to stop contributing and to enroll in Medicare if you are still working. Now let's talk about Part B. Part B's medical expenses. And for 2020, you can see what the costs are associated with Part B. Now, unlike Part A, Part B does have a calendar year deductible. There's one deductible per year. It resets every January 1st. There is also a premium associated monthly that everyone pays. And usually people pay their Part B premium out of their Social Security check if they're receiving Social Security benefits. If they're not receiving Social Security benefits, then they get billed on a quarterly basis from Social Security for their Part B premium. Now, the Part B premium for 2020, as I mentioned, is $198. Again, assuming you have nothing else other than original Medicare A and B, this is what you would be responsible for paying based on the out-of-pocket expenses and the care received. So when you go to the physician's offices for medical expenses and outpatient care, you can see medical expenses are picked up by Medicare at 80% after you've satisfied your $198 deductible, and your share in the you pay column is 20%. Well, what are excess doctor charges? Well, if you look at the bottom of my chart here, and it may not be very legible, but the first paragraph and the first sentence talks about a concept called Medicare assignment. When you're on Medicare, it's a good idea when you're making an appointment to see a physician to always ask, when you're making the appointment, does the doctor accept Medicare assignment? Asking the question in that way is different than asking, does the doctor accept Medicare? The reason why you want to know if the doctor accepts Medicare assignment or not, if the doctor does not accept assignment, it means they are permitted by law to balance bill you as much as 15% over and above the Medicare approved charges. And that would be your responsibility, which is why it's listed here under the you pay column. It's good to know before you go. It's easy to avoid those excess doctor charges and getting that surprise bill later on by just asking. Lab work is covered in full by Medicare, no cost to you. Home health care. The reality is, if you look at your Medicare handbook, home health care is covered under both Parts A and B. On this particular chart, they're showing it just under B. It is limited. It's not like having 24/7 of care like a long-term care policy would offer you, but what they do cover is at 100%. And if you do need durable medical equipment, such as wheelchairs, walkers, oxygen, CPAP machines, those are things that are defined as durable medical equipment, and your responsibility would be 20%. Again, all of these categories here are subject to that $198 deductible. Outpatient hospital treatment is covered under Part B, and that coinsurance for you is really dictated based on what the billing codes are. You're best off checking with your doctor to find out what you could expect to pay out of pocket if you're having outpatient hospital care. And then, of course, blood. Medicare will pick up 80% after you've paid for the first 3 pints. Okay. I'm trying to move my slide over again. Here we go. All right, so I'm going to go to this second paragraph here. Most people need to enroll in Part B when they turn 65, unless they have coverage through their own employer or through their spouse's employer. Now, if you're still working and your employer is bigger than 20 employees, then your employer plan is primary and Medicare would be secondary. That would be a good reason to delay enrolling in Part B. If your employer is smaller than 20 employees, then Medicare is always going to be primary, and therefore you must take Part B. The employer plan would be secondary. Okay, so this is just a recap of some of the costs that we have already reviewed. But what I wanted to point out to you is that there are 2 parts of Medicare that actually are based on your income. Part B for B like boy and D for drug. Social Security determines if your income is higher than average. And if your income is higher than average, Social Security subjects you to something called an income-related monthly adjustment. And many people also ask me about whether or not Medicare premiums are tax deductible. They are. And you just need to meet that requirements. I recommend that you speak to your tax advisor to find out if it's something that you can deduct. And I want to go into more about what the income-related monthly adjustments are that Social Security could subject you to, both on your Part B premium as well as your Part D drug plan premium. So here you see is a modified adjusted gross income chart. Now, income-related monthly adjustments have an abbreviation called IRMA. So we call it IRMA, income-related monthly adjustment. This is based on a 2-year look back. So Social Security, if you become eligible for Medicare in 2020, they're going to look at what your income was in 2018. And you can see it's based on single or joint income if you're married. In the first category, you can see that your Part B premium went from $144.60 per person up to $202 based on the higher income, and that the Part D drug surcharge added onto your drug plan premium would be an additional $12.20. This information is important because you have to budget for it. So you need to know what your costs are going to be when you're looking at the big picture. Okay, so we talked about Part A and Part B, what the costs are for premiums. Let's talk about what's not covered in terms of some services. So Medicare A and B does not cover custodial care, which is also known as long-term care. That's something that's covered by if you had a long-term care policy. Medicare also does not cover most dental care. If you had emergency dental, perhaps if you fell down the stairs and broke a tooth or had an injury to your teeth as a result of an emergency, that's when Medicare would cover your dental for that accident. Eye exams related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids, and the exams for fitting the hearing aids are not covered. Podiatry or routine foot care is not covered. And outpatient prescription drugs are not covered by Medicare, which is why you're required to purchase a Part D drug plan. And I should say you're not required, it is optional. Most people choose to enroll in a drug plan. If they do decide to defer it until later on, you could be subject to a late enrollment penalty. So I like to bring these charts in from time to time because it helps bring you back to what we've just covered. So you can see we have now talked about Part A. And by the way, this chart is a little old, so I apologize. The costs that are listed on here are old, but I like the chart because it lays things out nicely, so I like to use it. I apologize I didn't amend it. So we've talked about Part A, original Medicare A, and Part B. Medicare finally realized that there was a need to come out with a program to cover those out-of-pocket costs that are left for you to pay in the gap, so to speak. And so the concept of Medicare supplements and Medigap plans was created. And I keep losing my mouse to change my slide, so hang on, I'm sorry. Technology. Let's see. Oh, there we go. Nope, I lost it again. There we go. We did that. We did that. Oops. I went backwards. How come?
So you can use the arrows on your keyboard if you want, the forward and back arrows, and that'll move the slides for you too. And you can use the space bar.
Okay, great. Thank you, Jessica. Thank goodness Jessica's on and she is very tech savvy. Okay, so There are two ways to get your Medicare benefits: keeping original Medicare Part A and B, purchasing that supplement concept that we just talked about, a Medigap plan, also known as Medicare supplements, and pairing it with a Part D drug plan. We're going to talk about the other way of getting your Medicare benefits later. Let's talk more about Medicare supplement plans, also known as Medigap. So as you see, these plans help cover the costs left in the gap after Medicare pays out on approved Medicare expenses. Medigap plans do not cover prescription drugs because Medicare doesn't cover prescription drugs. Any expense that Medicare does not cover, the Medicare supplement will not pay out on a secondary basis. They strictly cover expenses after Medicare pays out on a covered expense. Okay, here we go. Now it won't let me advance again. So Jessica, I'm trying the arrow and it's not working.
Hit the space bar.
Okay, here we go. Okay. No, it's not your blurry vision. This slide is very blurry. So I chose this slide not because it's blurry, but because it represented more clearly the information I wanted to convey. This is a chart of all the different Medicare plans, Medicare supplement plans or Medigap plans on the market. We're going to highlight 3 of the more popular plans, and we're also going to talk about a law called the macro law that just went into effect January 1st and how it may or may not impact you. So any insurance company that wants to sell Medicare supplement plans has to have a contract with Medicare, and all of the benefits that they offer are by letter. And you see there are letters going across the top of the chart. Don't get confused by these letters at the top of the chart. Don't confuse them with the parts of Medicare. You know, somebody at Medicare thought they would be really smart and label the Medigap plans some of the same letters that are the parts of Medicare to confuse you even more. So I'm here to kind of make it all make a little sense for you. The more popular plans in New York are plans F like Frank, G like good, and N like Nancy. Now, these plans are standardized in their benefits. So the insurance companies that market them, Plan F with one company is the same exact benefits as Plan F with another company. Medicare dictates those benefits. They cannot change the benefits under the letter, but they are allowed to change the premium for that respective letter. It's like buying a car. If you're going to buy a Chevy from a Chevy dealer around the corner, and you're going to buy the exact same model with the exact same options from another dealer, the other dealer may sell it cheaper, or it may be less expensive for the exact same thing. Well, that's how it works with Medigap plans. The plan letters are the same, so the models are the same, but Medicare allows them to charge different premiums. The best money can buy is Plan F, like Frank. And you can see on the right-hand side, the far right side, Plan F has every check mark. And that's because Plan F is the richest in benefit. It covers all of the out-of-pocket expenses that we discussed under Part A and B, under the You Pay columns for those Medicare-approved charges. Plan G is very similar to Plan F. The only difference between G and F, you'll notice that the Part B deductible is missing out of the Plan G column, which is right here. So what that means is if you have Plan G, if you've purchased Plan G, you are responsible for paying your Part B deductible on your own first, and then the supplement or the Medigap plan will pick up all of the other expenses under Part A and B that are approved Medicare charges on the chart we looked at. Now, you should know that Medigap plans and Medicare supplement plans, as they're also known, also provide you with an additional 365 days of hospitalization. So although Medicare does cut you off after 150 days in the hospital, the Medigap plans will provide you with additional hospitalization days. Now, the third plan that's very popular and less expensive than the other two is Plan N, like Nancy. Plan N, when it comes to Part A expenses in the hospital and skilled nursing, Plan N covers all of Part A expenses in full. But when it comes to Part B, it's slightly different. First, you'll notice that Plan N has copays associated with it. And if you look at the bottom of this chart, it lays out that Plan N has a copay of $20 for most office visits, $50 for emergency room visits. It also has that box empty for Part B deductible. You pay that on your own. And also, it does not cover any excess doctor charges for the doctors that don't accept Medicare assignment in case you ran into any of those excess doctor charges. Now, there's a high deductible Plan F, which is not very common, but you may hear about it in the community. It's called the high HDF. There's also a new plan out called the high HDG, high deductible plans. These are lower in premium, but in 2020, the high deductible plans require you to meet a deductible of $2,340 before the Medicare supplement will pay out any expenses for you. Here I go again, not being able to move. Jessica, how do I do it? I
would say either hit the space bar or just try clicking on the bottom of the screen to get like your arrows up again.
Okay, there we go. All right, so let me give you more information about the macro law. Anyone who is not already 65 or eligible for Medicare based on a disability before January 1st of 2020 is not eligible to purchase Plan F or C Medicare supplement. The reason being is that Medicare wants seniors to participate more in the out-of-pocket expenses because the truth is Medicare is hurting. They're not really sure if Medicare is going to be able to be funded beyond 2029. So Medicare is trying to share more of the costs with the seniors. The good news is if you are already 65 or already have Part A prior to January 1st of 2020, you are eligible to purchase Plan F or C anytime now or in the future. And even if you don't have it now, it will always be available to you to purchase if you were already 65 before January 1st of this year or already eligible for Medicare based on a disability. So this chart pretty much shows, gives you a little more information about the macro law and which plans people are eligible for based on their Medicare start date. All right, so let's recap. Medicare supplement, there's some advantages, a lot of advantages actually. They are guaranteed renewable for life as long as you pay your premiums. We talked about how the benefits are standardized by the government, and those benefits don't change from year to year. And the carriers cannot change the benefits during the year. There are no networks of physicians or hospitals that you have to stay within in order to get your Medicare benefits. So you have that freedom to use whatever provider you choose, as long as they accept Medicare and Medicare assignment, if you want to avoid excess doctor charges. And you also do not have to wait for annual enrollment period in the fall to make a change within the Medicare supplement plan choices. So if you wanted to change from May 1st from a plan F to a G, you could do so, and it would be effective the first of the following month. You would not have to wait for annual enrollment period. Annual enrollment period is only for people who have Medicare Advantage plans and Part D drug plans. And of course, a requirement in order to purchase a Medicare supplement is that you must have both Parts A and B and keep both A and B in order to have a Medicare supplement. Let's see. There we go. So how does a Medicare supplement plan work? Well, here's a good chart that shows you. You go to the doctor, your doctor then bills Medicare, and Medicare then, after paying out their portion, sends the balance of the bill directly to the Medigap carrier that you have. Well, how does Medicare even know what you have? They know everything. Anytime you enroll in a plan, that information is shared with Medicare. So exactly for this reason, so they know, based on eligibility and based on your plan of benefits, who to send the bill to, unless you have a Medicare Advantage plan, which is a little bit different. Okay. Medigap plans offer you a lot of predictability and flexibility. If you are someone that's managing a lot of chronic conditions, or you like to visit the doctor a lot, or it's out of necessity, or you have a lot of elective procedures coming up, or you just want that predictability, a Medigap plan is good for you. It's all based on your budget. No matter how often you seek out care, the premium that you're paying for that Medigap plan is going to cover you for all of the Medicare approved charges, no matter how often you're accessing care. There are no restrictions. Again, there are no copays unless you're on Plan N Medicare supplement. But one of the disadvantages of these Medicare supplement plans is that their premiums are generally higher than what Medicare Advantage plans could be. That's the one disadvantage of Medicare supplement plans, is their cost. Not everyone can afford them. So here again, I like to bring another chart in. Let's review what we've discussed so far. This is another way to look at it. We've talked about original Medicare Part A and B. Option 1, you can add a Medicare supplement, right, that we've now talked about and defined and described how they work. But because Medicare supplements don't cover prescription drugs, and neither does Medicare, you're not done. You need to purchase a prescription drug plan to cover your outpatient prescription drugs. Now, it is optional. You don't have to take a drug plan right away. However, if you take it later on without having credible coverage during that period, you could be subject to a late enrollment penalty. Late enrollment penalties stay with you for life. They do not go away. Now we're going to talk about option 2. We talk about drugs, the Part D drug program a little bit later. I want to now go to option 2, which are Part C plans. They have a name called Medicare Advantage plans. Medicare Advantage plans came out back in 2005. They're the newer way to get your Medicare benefits. Now, you must have both Part A and B in order to be eligible to enroll in a Medicare Advantage plan. You also have to live in their service area. Most Medicare Advantage plans already include prescription drug coverage bundled in with it. They usually have copays. Some plans have deductibles. They usually also include additional benefits like wellness benefits that original Medicare does not offer you. And these plans are offered by private insurance companies who agree with a contract to administer your care, pay your claim, and collect premium from you. Essentially, it's an all-inclusive plan. When you purchase a Medicare Advantage plan, you no longer have Medicare as your primary. You have an all-inclusive plan from a private insurance company who has a contract with Medicare and receives a subsidy from Medicare to do their job. And that subsidy helps them keep the premium low. So this option, option 2, it was created to help make a more affordable way for seniors to get their Medicare benefits. Let's talk more about Part C plans. Some of the types of extra benefits that you receive with a Medicare Advantage plan are wellness benefits. Some plans include dental, eye care, including eyeglasses. Some include hearing aids and hearing visits, as well as other types of wellness visits. Again, you have to live in their service area. And you cannot have end-stage renal disease, and that's a requirement that's dictated by Medicare, that if you have end-stage renal disease, presently you cannot enroll in a Medicare Advantage plan. But there is legislation that's actually pending right now that allows Medicare Advantage plans to accept people with end-stage renal disease, and Medicare will increase their subsidy. The legislation has not been passed yet, but it is pending. So let's take a look at what Medicare Advantage plans cover. Remember, we talked about the out-of-pocket expenses under original Medicare, right? A and B, the A deductible, the co-insurance from the skilled nursing, the Part B deductible, and so forth. That cost sharing that you would have if you were under original Medicare, but then switched to an Advantage plan, that all goes out the window. The Advantage plan is going to take care of that. In return, you're going to have a lower premium, and you may have copays and deductibles designated by that Medicare Advantage plan. So whatever is listed on the Medicare Advantage plan summary of benefits is what the cost sharing you would have under that plan. So again, you have to have both Part A and B in order to have a Medicare Advantage plan. Most of these plans include prescription drug coverage, so you do not have to go out and buy a separate drug plan. And another advantage is they also put a limit on your out-of-pocket expenses for the year in case you do have a catastrophic health year. You don't want to have an unlimited amount of money that you're having to spend. The plan will cap it for you. And that is, again, is dictated by Medicare. They do not do that under original Medicare. Okay. A Medicare Advantage plan might be ideal for you for a number of reasons. If you are low income and you cannot afford a Medicare supplement, or if you're just looking for the convenience of having just one plan and having all of your coverage combined under one plan with one card for one premium. Now, just as a reminder, you always have to continue to pay your Part B premium. You pay your Part B premium for life, no matter which option you go with. And no one, because in New York, can be denied access to a Medicare Advantage plan based on health. The only exception to that is if they have end-stage renal disease as of today. So there are two types of Medicare Advantage plans. There are HMOs and there are PPOs. Later, we're going to talk about a third type called a special needs plan. But for right now, let's focus on these two. You may be familiar with the term HMO. You may be familiar with the term PPO from perhaps an employer plan that you've been on. Very similar concept. A Medicare Advantage plan can be an HMO or a PPO. An HMO is a network of doctors and hospitals, and you receive all of your Medicare benefits from the private insurance company that has the contract with Medicare, utilizing their doctors in their network. And many of your doctors may already be participating. This plan is a little more restrictive than what a PPO would be. On an HMO, you may also need a referral to see a specialist. Some plans do require referrals under an HMO. Some HMO plans do not require a referral. The second type is the PPO. With the PPO, which stands for Preferred Provider Organization, again, you're getting all of your Medicare benefits from this private insurance company, but you have more freedom. The plan also has a network of doctors and hospitals where you get your Medicare benefits, but you can go out of the network and access care, but you're going to pay a higher out-of-pocket expense. And you'll be informed of what your out-of-pocket expense is because it would be listed on the summary of benefits for that plan that you are considering. PPO plans do not have referrals. There are no referrals required to see a specialist on a PPO plan. So it affords you more freedom and more flexibility. Both HMOs and PPOs are very low premium. Medicare has set them up that way for you. That was the goal of creating these. Some of the advantages of Medicare Advantage plans are they provide that all-inclusive concept for you. You're getting all of your benefits under one plan with one company. You have one card and one premium. The premiums for these plans, and yes, in Nassau and Suffolk County, they are as low as $0. Remember, we talked about Medicare gives these private insurance companies a subsidy to pay your claims. You must continue to pay your Part B premium in order to stay in the Medicare Advantage plans. Medicare Advantage plans also give you unlimited days for hospitalization. We talked about those extra benefits that they offer you, such as dental, vision, hearing, and free gym memberships, most of them with silver sneakers. But just keep in mind, not every Medicare Advantage plan will have all of these benefits embedded in them. We talked about these plans have a maximum out-of-pocket in case you have a catastrophic health year to help you contain your costs. And that max out-of-pocket is called a MOOP. They provide you worldwide emergency coverage. Even if you're traveling abroad, you can get reimbursed for your out-of-pocket expenses minus an emergency room copay, which is usually about $90, could be a little bit less on some plans. They give you the ability to file an appeal or a grievance. And many of the national plans offer networks in other states to help you access care if you're traveling. So it doesn't have to be an emergency. If you just need to go to a doctor when you're visiting family in another state, maybe you need an antibiotic, it's not life-threatening, you can still find plans that have networks in other states. And if that's important to you because you travel, you may want to choose a national plan if you think you're a great candidate for an Advantage plan. Now, there are also star ratings that Medicare provides that help guide you to determine how these plans perform in different categories. And the star rating system ranges from 1 to 5, 5 being the highest, 1 being the lowest. It's important that the insurance company gets high star ratings, not just the Medicare Advantage plans, but the drug plans too. You know why? If they have star ratings low for a continuous number of years, 2 to 3 years, it could affect the subsidy that they receive from Medicare. So they want to keep you happy. They want to make sure they're paying the doctors promptly. They want to make sure your claims are getting paid, and they want to make sure that they are performing well under Medicare's performance guidelines. What are some of the disadvantages? Well, you are restricted to a network of providers of doctors and hospitals. If you have a PPO, you do have the freedom to go out of the network. You just pay a higher out-of-pocket. They do have co-pays and deductibles. Oh, I see my sentence got left, the rest of my sentence got left off. Sorry about that. And those co-pays and deductibles can change every year. But honestly, the truth is, Medicare changes their out-of-pocket or their co-pays and coinsurance under original Medicare also. So these Medicare Advantage plans follow suit to whatever original Medicare is doing. There are only certain times of the year that you can change your Medicare Advantage plan unless you have a special enrollment period. And we're going to talk more about different enrollment periods and what qualifies as a special enrollment period a little bit later on. Now, these plans also change their drug programs that are built in. So their copays and even their lists of covered drugs, known as a formulary, changes. Their drug deductibles change as well. Some of the smaller companies, the regional plans, can leave a service area. And that did happen last year and the year before. So if that happens to you, you get a notice from Medicare saying that your plan is no longer going to be offering coverage in your area and that you have a special enrollment period to pick another plan to meet your needs and your budget. Another disadvantage is, the truth is, doctors can drop out of the plan. More often than not, these plans are adding doctors every day. Many doctors realize that their patients are baby boomers, and the baby boomers are aging into the senior market. Doctors are very smart. They don't want to see their patient base erode. They're running their practice just like a business. So if they know that their patients cannot afford Medicare supplements for the rest of their life, and that more and more are jumping on these Medicare Advantage plans because they're comprehensive and more affordable, many doctors decide that they too want to participate so their patients can continue seeing them. Now, another type of Medicare Advantage plan is for people who qualify for both Medicare and Medicaid. These are called DSNP plans, which is dual eligible special needs plans. Now, you have to already be eligible for both in order to qualify for a DSNP. And these DSNP plans cover your doctor's visits, hospital stays, and prescription drugs, and they generally offer extra benefits that Medicare and Medicaid do not offer. They also will cover dental care, eye exams, transportation. Some of them are also offering very creative types of benefits for things such as pest control for people who have COPD and have trouble breathing or have asthma. Not everyone lives in the healthiest or cleanest environment, and Medicare is aware of that. And so the subsidies allow these private insurance companies that are selling these D-SNPs to offer creative benefits to help their populations. Now, let's talk about prescription drug coverage, Part D, which was the fourth part of Medicare. Anyone who's eligible for Medicare is eligible to enroll in a drug plan. You do not have, if you just want a drug plan and not a Medicare Advantage plan, and let's say you do not want a Medicare supplement, you do not have to have both A and B in order to enroll in a drug plan. You must have A or B. You can have both A and B, but you do not need to have both A and B in order to pick up a Part D drug plan. Now remember, some people are receiving their drug coverage through their Medicare Advantage plan. People who are staying with original Medicare and purchase a supplement can get their prescriptions by purchasing a Part D drug plan. How does a drug plan work? Well, I mentioned to you before, it's optional. If you delay and you don't have credible coverage, when you do decide to enroll later on, you could be subject to a late enrollment penalty, and those penalties stay with you for life. Each of these drug programs has a list of covered drugs, and those are called their drug formularies. And those drug formularies change every year. And sometimes you'll get a notice in the mail saying that they've changed their formulary mid-year. That happens. Medicare allows them to do that because it's based on what the plan is having to pay the manufacturer for the prescription. Drug prices fluctuate, and that's why these plans fluctuate their formulary. Every drug plan will have a deductible and copays for each of your prescriptions. For people that need help covering the cost of their prescriptions, there's a program through Social Security called Extra Help. We're going to talk more about that later. You must live in the plan service area in order to be eligible for that particular drug plan. You cannot live outside the United States or be in jail, and you must actively enroll yourself in most cases. The exception to that is sometimes people who are on disability and become eligible for Medicare, if they have extra help through Social Security, Medicare may automatically enroll them in a drug plan without them even joining voluntarily on their own. Okay, more about Part D. Every prescription drug plan that is out there will vary from plan to plan. They do have catastrophic coverage built in to protect you from very high costs. And again, their benefits can change every year. The formulary is what they call their list of their drugs that they cover. You want to always make sure that your prescriptions are covered not only on their formulary, but in a favorable position on a low tier so that it's affordable to you. And it's important not to be complacent with your drug plan. When annual enrollment comes, which is the time of year you'll have the opportunity to change your drug plan, don't be complacent. You want to reshop your drug carrier and your drug plan and see if what you have is best suited for you for the following year, because all of these plans change their copays, their deductibles, and their benefits. We talked about enrollment. Okay, so I kind of mentioned about a Part D formulary. What are the formularies and the tiers? So there are generally 5 tiers on every drug plan. Tier 1 is preferred generic. Tier 2 is non-preferred generic. Tier 3 is preferred brand name. Tier 4 is non-preferred brand, and Tier 5 is specialty. Now, you may have a drug that's covered on a low tier this year, and because next year the plan's changing their formulary, it could get bumped up to a higher tier, which could mean a higher copay to you, which is why it's very important that you pay attention to the annual notice of change that you receive at the end of the year from your plan to determine if it's well suited for you for the next year. And the lower the tier, the lower your copay. Now, Medicare dictates what they call 4 stages of a drug program. These 4 stages are relevant no matter if you're getting your drugs through a Medicare Advantage plan or if you're getting your drugs through a freestanding Part D drug plan that you've paired with a supplement. Now, this is probably one of the most difficult parts of Medicare to explain to people. So, I am going to do my best. The first stage is called the deductible. But know that not every drug plan under a Part D has a deductible. If you don't want a drug deductible, you can find a Part D drug plan, but it may be expensive. Medicare caps how high the drug deductibles can be for 2020. The limit is $435 for the deductible. Once someone meets their deductible, they go into the next stage, which is called the initial coverage phase. Now, I want you to imagine there's a bucket on the floor. And in that bucket, Medicare says you are going to fund in that bucket, Medicare is going to put an imaginary $4,020 in that bucket. You go to the pharmacy, you've met your deductible, and now you pick up your medication, and let's say you have a $2 copay for that prescription. The insurance company's share for that prescription, let's say, is $98. So what you pay in combination with the insurance company for that prescription is combined. So in my example, it's $100, 2 plus 98. $100 gets taken out of the bucket that has $4,020 in it. Now, that happens each time you fill a prescription. The combined cost of what you and the insurance company share for your prescription then gets taken out of the bucket. When the bucket is empty in the calendar year, you then leave stage 2 and you go into stage 3, which is called the coverage gap. Many people call this the infamous donut hole, because when you're in the donut hole, you are responsible for a lot more of your prescription drug costs. You're going to be paying 25% of the retail cost of both your brand name medications and your generics. You're not paying a small copay anymore, unless you're on a plan that has extra coverage gap assistance. And there's a few plans out in the market that do offer that. Now, you may be familiar with the term donut hole if you've been in the donut hole in the past, if you're already on Medicare. And you know it's not a great place to be because it can be very expensive for your medications. So how do you get out of the donut hole? Well, as you can see, when your costs that you pay on your own in the calendar year, when your costs alone have reached $6,050, you leave the donut hole and now go into the catastrophic phase, where the cost of your medications is going to be reduced to a much lower amount. So you pay the greater of 5% of the medication, or $8.95 for a brand name, or $3.60 for a generic. I hope everybody kind of tracked me on that. It's a little confusing. If you don't get it, don't worry. You're not alone. All right, now what I'd like to talk about is all these different enrollment periods. You know, Medicare is known for having all these different acronyms with plans and enrollment periods. So let's talk about some of them, and then we're going to go into a little more detail. If you're just turning 65, you have what's called your initial enrollment period. Now, let's say you're not working. Your initial enrollment period, which you do not have to take advantage of if your employer is bigger than 20 employees. Your initial enrollment period is the 3 months before your birthday month. It includes the month of your birthday, and then the 3 months after your birthday. So you have a total of 7 months. And I try to tell my clients, do not wait until after your birthday to enroll in Medicare if you know you want Part A and Part B. Now, there's another period called open enrollment, or actually it's annual enrollment is the proper term, because it happens annually every year at the same time. And that is October 15th through December 7th. And here you can see what you can do during that time. You can sign up for a new plan, you can switch your plan, and you can leave a plan. Now, special enrollment periods are certain times that Medicare permits you, based on certain circumstances, to either change your plan like a Medicare Advantage plan and go back to original Medicare, or pick another Medicare Advantage plan, or if you haven't taken your Part B because you're still covered under an employer plan, and either you're going to be leaving your employer or you no longer want to keep your employer coverage now that you're 65, and let's say you're 66 and your employer plan is just too expensive at this time, you can enroll in Part B under a Part B special enrollment period and apply for Part B without a penalty. If you move to another area of the country or out of the service area of your plan, whether it's a Part D drug plan or a Medicare Advantage plan, that move qualifies as a special enrollment period to change your plan. Now, if you missed your initial enrollment period, we're here in general enrollment period. So that means you can sign up January 1st to March 31st for Part A and B if you didn't sign up when you were first eligible. However, your coverage is not going to go into effect until July 1. So you may sign up between January and March 31st, but your coverage will not go into effect until July 1st. Then we have a new period called Medicare Advantage Open Enrollment. And this actually coincides with the general enrollment period. This is for people who have Medicare Advantage plans, and only for the people who have Medicare Advantage plans. And at this time, people can switch to another Medicare Advantage plan or leave their Medicare Advantage plan and go back to original Medicare, buy a supplement, and buy a drug plan. And of course, because we're in New York, there is no medical underwriting and it's guarantee issue. There's no waiting period. you can do so because you're doing it during a qualifying period under Medicare. That's a question I usually get quite often, is can I go back to a supplement after having an Advantage plan and not be subject to any medical underwriting? In other states, you cannot. In New York, you can. Okay, so what's step one? You want to enroll in Part A and Part B when you're first eligible. Oops. Okay, so one of the questions is, well, how do I actually enroll in Part A and Part B? If you are already receiving Social Security benefits when you turn 65, you will automatically be enrolled. If you're not collecting Social Security when you turn 65, you need to sign up for Part A and Part B. You contact Social Security because this is your initial enrollment period. So you want to contact them 3 months before you turn 65. And if you work for the railroad, you want to contact the railroad board. People on Social Security disability will automatically be enrolled in their 25th month of disability. There we go. Okay, now let's talk more about this initial enrollment period, because I meet many people who tend to forget when they're supposed to go down to Social Security or go online to sign up when they first become eligible for Medicare when they're turning 65. And this chart really describes what happens if you delay going down. So if you go in and sign up during the 3 months before your birthday month, your coverage will begin the first day of the month of your birthday month. If you go in during the month of your birthday, your coverage with Medicare is not going to go into effect until the first of the following month after your birthday. If you go in the month after your birthday month to apply, your coverage is going to begin 3 months after your birthday month. Now, that might have caused you to have a lapse in coverage. Maybe you were on the New York State of Health, and the New York State of Health sent you a notice saying you're being kicked off because you're eligible for Medicare now. Uh-oh, you may have a lapse in coverage. If you go in the second month after your birthday month, your coverage won't begin till 5 months after your birthday month. And here you see, if you go in the third month after your birthday month, look at this, 6 months after your birthday month. Okay, so are you penalized if you don't sign up for Medicare at age 65? Well, if you have not maintained credible coverage, perhaps through an employer, then you could face a penalty. And the penalties are stiff. They are 10%. And they do not, and those penalties stay with you for life. They do not go away. So it does pay to sign up for Medicare if you don't have other coverage, or if you do not have employer coverage. Now, we talked about the Part B SEP, which is the special enrollment period, which allows you to delay enrollment without a penalty if you were covered with credible coverage through either your employer or through your spouse's employer. Step 2, you want to decide which way you're going to go. Option 1 is to keep original Medicare, add a Medicare supplement and a drug plan, or do you feel that you want to go with a Medicare Advantage plan? Remember, you need to have both Part A and B, even if you want a supplement. And if you want an Advantage plan, you need A and B. You do not need to purchase a drug plan because it is all inclusive and is already covered under your Medicare Advantage plan with copays. When can you enroll in Part C, which is a Medicare Advantage plan, and a Part D? Well, in the same 7-month window, which is your initial enrollment period. What is annual enrollment period? I mentioned it briefly before. It takes place every year between October 15th and December 7th. And any change that you decide to make during that time goes into effect for January 1st. It applies to people who are on an Advantage plan, which is Part C, and it applies to people who have a Part D drug plan that goes with their Med Sup. The general enrollment period, as I mentioned before, is if you missed your initial enrollment period, you have between January 1st and March 31st to sign up. Your coverage does not go into effect until July 1. And you may incur a late enrollment penalty that unfortunately Medicare says stays with you for life. Now, there are many different types of special enrollment periods. Someone can call me today and say, I'm not happy with my plan, or I can't afford my plan anymore. Can you change my plan now? Well, we look to find a special enrollment period that will qualify based on their circumstances. We talked a little bit earlier about how you can delay enrollment in Part B if you have coverage through a spouse's employer or your own. And then if you do have a regular special enrollment period, like if you move or if you go into an institution like a skilled nursing facility or leave a skilled nursing facility or rehab, your coverage will go into effect the first of the following month. Now, you may discuss with your neighbors, your friends, what they have. But what I want you to remember is that this is a very individualized decision. And even a husband and wife should be making their own individual decisions. You don't need to have the same plan like you do when you are covered by an employer. It's based on your own individual health needs and your budget and your preferences, because there really is no one size fits all. Every year, Medicare gives you that annual enrollment period so you can reevaluate what plan is going to be a good fit for you for that following year. But I know it can be very confusing. And you always have to make sure that you pay your Part B premium. So you have many different types of options. How do you go about deciding what is going to be best for you? You have to ask yourself some questions. And I know we've been on for quite some time now, so I'm going to go through this very quickly. You want to ask yourself, how often do you go to the doctor? What kind of medications do you take? What kind of expenses did you have with out-of-pocket expenses for medical the past year? Was that a typical year for you, or was that just a bad year? Or maybe next year, you know, you're going to have a lot of medical expenses coming up. Maybe you have a new hip surgery coming up or a new knee, and that could be costly. Do you have a particular doctor, hospital, or pharmacy that you want to research and make sure they're in a network if you're considering a Medicare Advantage plan? And we talked about surgeries. If you have end-stage renal disease, well, at this time, you're not eligible for a Medicare Advantage plan. But if you have a chronic condition, there may be a chronic special needs plan available to you. It all depends on where you live. Presently on Long Island, there are no chronic condition special needs plans. We had one, but that plan is no longer on the market. Do you travel a lot? Do you have retiree health coverage from a former employer? or from a union or the military? Do you live in a long-term care facility? Now, there are many different types of low-income plans out there. I'm just going to touch on these very briefly. Just know there is help out there. You can always contact Medicaid, and if you do qualify for Medicaid, you then become what we call that dual eligible. You're dually eligible for both Medicaid and Medicare. But what if you don't qualify for full Medicaid? You may have a low income, but maybe your assets are still too high for Medicaid. You're still low income. There are plans called Medicare savings programs that still give you extra coverage. There are 3 different types, and some of them will pay your Part B premium for you. There is a program called EPIC, which is known as a state pharmaceutical assistance program. This is designed to provide secondary prescription drug coverage for anyone on a Medicare Part D drug program or on a Medicare Advantage plan. If you only have coverage, for example, through the VA, and you did not opt for a Part D drug program through Medicare or a Medicare Advantage plan to cover your prescriptions, you cannot enroll in EPIC. It will not help you. But these SPAPs, or state pharmaceutical assistance programs, also qualify as a special enrollment period once a year, where if you qualify based on income, you get to change your plan when you want without having to wait for Medicare's enrollment periods. Some of my clients call them the get out of jail free card. There's also a program called Extra Help. And again, Extra Help is available. This is through Social Security to help you pay for your prescription drug coverage. Okay, do I need to sign up for Medicare at 65? If I'm still employed. If you're still working and you have coverage through an employer, and the employer is a big company and has more than 20 employees, you do not have to sign up for Medicare right away, but you should consult with your Human Resources Department. You will not be penalized for not signing up for Part B. And when you are ready to leave your job or retire, or if you get laid off, or perhaps you're just not happy with your employer coverage anymore because it's too expensive, you're still employed, but you want to leave the employer plan, you can do so. So that would be a time then you would enroll in Medicare. But again, you should always check with your Human Resources Department. If your employer is small and they're less than 20 employees, and you're still working and expect to continue to work, Medicare is primary. That's a law. And if you don't have Part B, then your employer's plan is not going to pay out anything because on the Part B side, because you didn't enroll in Part B. So that's a scenario where you would need to sign up for Part B right away so that your employer plan will be secondary and Medicare will be primary. Now, if you have COBRA, COBRA is viewed as individual coverage. So if you've left an employer, essentially you have 63 days to get on a plan so that you can avoid a late enrollment penalty for the drug plan for Part D. Medicare says that COBRA is not considered credible because it's viewed as individual. But technically, when you leave an employer, you have up to 8 months to enroll in Part B. But you only have 63 days to enroll in Part D, like drug. I think these other points we made earlier, so I'm going to skip them. Should I enroll in a drug plan? Well, do you have credible drug coverage now? Coverage as good as Medicare's. That's what credible means. For example, through an employer plan. So if you want to keep your employer plan and it's credible coverage, then you do not need to enroll in Part D. Sometimes union plans may not be deemed credible coverage or as good as Medicare's under Medicare's rules. So you always want to ask your Human Resources Department for confirmation of whether or not your coverage is considered credible. They, by law, must provide you with a letter, and usually you see that letter and it gets supplied to the IRS at the end of the year when you do your taxes. You want to evaluate what are the premium costs for Part D plans. And if you don't enroll or you're enrolling without credible coverage, you may have a late enrollment penalty if you delay enrolling in a Part D plan. Now, what happens if you're a veteran? I do meet quite a few veterans who say, well, you know, I have A and B, or I have just A and I don't have B and I don't have a drug plan. Do I really need it? And the answer is you should have it. You do need it. Whether or not you choose to get it is up to you. You know, if you do want to go for a second opinion, the VA will generally not cover any expenses from a provider that's not a VA provider. So I generally encourage veterans to have A and B and to consider a Medicare Advantage plan, a zero premium and Medicare Advantage plan as a backup, as a safety net. Because if they're not paying a premium for the Medicare Advantage plan, well, it's a zero premium plan. It's kind of a no-brainer. And this way, if they do need to get a second opinion or go outside the VA, now at least they'll have coverage for it, and they didn't have to pay a premium just to have that safety net. It was zero. If you do not have any health insurance at all when you first turn 65, you should enroll during your initial enrollment period to avoid any penalties later on. Now, what card should you show when you go for care? Well, that all depends on what type of plan you have. So everybody who signs up for Medicare gets that red, white, and blue card. And your Medicare card no longer will have your Social Security number on it. Now it has a random code, and those new cards were sent out last year. If you choose to keep your original Medicare Part A and B, you want to show your Medicare card whenever you go for care. And if you purchase a supplement to go with it as secondary coverage and a drug plan, you want to show your Medicare card and your Medicare supplement card when you go to the doctor or the hospital or the lab. When you go to the pharmacy, you want to show your prescription drug card. If you choose to get your benefits through a Medicare Advantage plan, you're still going to have that Medicare card that you received, but you don't want to show that card because you're not receiving your benefits through original Medicare anymore. You're getting all of your Medicare benefits through that private insurance company as the Part C carrier. So you only show the Medicare Advantage ID card whenever you go to the doctor, the hospital, the lab, or the pharmacy. Any provider, that's the only card you're showing. You're going to keep your Medicare card in a safe place at home. I kind of encourage you not to carry it in your wallet if you have a Medicare Advantage plan, because then you might get confused and show the Medicare card by mistake. You only want to show your Medicare Advantage card. And never give out your Medicare ID number to anyone or a stranger, unless it's your doctor or healthcare provider or someone who's trying to help you enroll in a plan. So let's recap what the differences are between Medicare supplements and Medicare Advantage plans. Well, if you see on this left column, we have Medicare Supplement, and to the right in red, we have Medicare Advantage plans. Well, under a Medicare Supplement, you select your doctors, you have that freedom and flexibility. You don't need any referrals because there are no networks under Medicare Supplements. You can enroll to buy a Medicare Supplement when you turn 65 or thereafter if you've had credible coverage either through an employer or after having a Medicare Advantage plan. But you must have both Part A and Part B. You pay a monthly premium for your Medicare Supplement, and depending upon which supplement you purchase will determine if you have any additional out-of-pocket expenses. Like Plan N we talked about on the supplement chart has those co-pays and also does not cover the Part B deductible. You do need to add a prescription drug plan because Medicare supplements do not cover outpatient prescription drugs. Now you can see on Medicare Advantage plans, you may be required to use their network of doctors and hospitals. If it's a PPO, you do have the freedom to go out of the network. Referrals, HMOs generally do require referrals, some do not. And if you have a PPO, there are no referrals required to see a specialist. Emergency care is actually covered worldwide, not just in this country. So you can go outside of the network if you have a life-threatening emergency, no matter if it's an HMO or a PPO, you can go to any doctor or hospital in an emergency. And with enrolling, there are generally only certain times of the year when you could switch your plan unless you have a special enrollment period. Costs are much less expensive on a Medicare Advantage plan from a premium perspective. You still pay your Part B premium as well, but you do have co-pays. Some plans have co-insurance and deductibles. And generally, the prescription drug plans drug coverage is already built into the Medicare Advantage plans. Now, this was a lot of information. And hands down, I can guarantee that most of you, unless you're a Medicare specialist, would say, she just confused me even more. So there's a lot of resources in the community to help you. There is Social Security. There's Medicare. You can also contact these state programs called SHIPs that can help you. And very often the libraries have these high cap representatives show up to give you one-on-one counseling in the library. You can contact the Department of Social Services. You can also contact the department, the Suffolk County Office for Aging in Hauppauge. And without a doubt, of course, you can contact me. There is absolutely no cost to you to call me, to enlist me to help you search out Medicare options for you that are going to be best suited for you. Whatever resource you go to, whether it's a financial planner, an agent, a broker, you want to make sure that that person is unbiased. And it's okay to ask, how many plans in New York are you certified with, Mr. or Mrs. Medicare specialist? So I know you're searching plans based on my needs as a consumer and not just based on a small network of carriers that you chose to get certified with. You want to work with someone that's certified with all the plans, and these plans require us to be recertified every single year with testing so that we know what all the new plans are and what all the new changes are in Medicare. I want to give a very special thanks again to Jessica and Danielle from the Patchogue Library. I want to also thank Lawrence Davidow and Joanne Grizzola from Davidow, Siegel and Stern, Family Service League, Robin Berger Gaston and Erin Englund, as well as the Riverhead Senior Center, Kelly Tochi and Deborah Schwartz and Danielle Dahl. So I want to thank you again for joining us today. I hope you all stay well and are managing to find things to keep you sane during this very, very difficult time. My name again is Cindy Goldsher, and it was a pleasure having this opportunity to share this information with you. And I realize there's going to be a lot of questions. So what we're going to do is I'm going to ask Jessica, because I am not able to see the questions, if she can start giving me questions. And again, if you have any questions later on, or you're not able to stay on the line right now, you can always contact me afterwards if you need to.
Thank you so much, Cindy. That was a great presentation. I feel like I personally learned a lot. I'm not anywhere near 65, but I have a good foundation to start off with now. So Megan is actually monitoring the chat, and there were a few questions that came in. So Megan's going to read them, but also Megan, can you unmute the people who are on the phone in case they have any questions?
Of course I can.
Okay, great.
Okay, the callers have been unmuted.
Okay. No, I'm not. Am I?
And
Yeah.
the
Oh,
first question was, can a pre-existing condition bar you from a plan? And that was
Okay.
from Brian.
Okay, so Brian, to answer your question, the only time a pre-existing will bar you from a plan is if you have end-stage renal disease prior to enrolling in Medicare. As of today, if someone has end-stage renal disease, they are not permitted to enroll in a Medicare Advantage plan. They would keep their original Medicare and would be allowed to purchase a Medicare supplement and a drug plan. If they are already on a Medicare Advantage plan and then they develop end-stage renal disease, they are permitted to stay on the Medicare Advantage plan if they want to. Does that help?
Yes, thank you, Cindy. We have another question coming in. It's about priority with keeping doctors. Would you choose a gap plan or a supplement plan depending on that? And how do you know for sure that doctors accept Medicare? Would you have to call each individual doctor for that?
Okay, so if I understood the question directly, let's do the first part. Jessica, can you repeat the first part of the question?
Sure. It says priority keeping doctors. Would you choose a gap plan or a supplement plan depending on that?
No, I would not say that that should be a prerequisite to make your decision. If you have relationships with physicians that you want to keep, which is very normal, of course. Everyone wants to stay with their doctor if they have a good relationship with their doctor. And if you're interested in a Medicare Advantage plan, very often you may find some, if not all of your doctors participating in some of these plans, because the level of participation from the physicians has been increasing. And there's over 21 million people on Medicare Advantage plans now because more and more doctors are joining these plans. Now, if you find that you are having to access care quite frequently and you are managing, let's say, a lot of chronic conditions and you're afraid that you might be building up a lot of copays, which could eventually become cost prohibitive, then maybe you want to consider a Medicare supplement with original Medicare. Or if you can afford a Medicare supplement right from the beginning and you want to have complete freedom and not even worry about if your doctor is in network or not of any of these Part C plans, then go ahead and choose a Medicare supplement. Now, the second part of the question, if you could repeat that, Jessica?
Sure. It's how do we know for sure doctors accept Medicare? Would you call each individual doctor?
Okay, so that's a very good question. You have a number of different ways. So any doctor that's participating in a Medicare Advantage plan, you know they already accept Medicare. So it's irrelevant. You don't even have to ask them because they're already participating in a plan. But if you have original Medicare and you've purchased a supplement and you don't want to get hit with any excess doctor charges, you can, number one, go onto Medicare.gov there is a way of researching doctors in your area to find out if they accept Medicare and assignment. Or if you don't want to be bothered with going online and doing that, you can just very easily call the doctor's office and ask, does the doctor accept Medicare assignment? And they'll know. And if for some reason the person answering the phone does not, and then you just ask to speak to someone in the billing department, because they certainly do know. That's their job.
Okay, so we have another, somebody said, thank you very much, amazing presentation. If anybody is on the computer and has a question, you can go ahead and type it in the chat box. If you are calling in and you have a question, we have unmuted you, so you can go ahead and ask your questions for Cindy now.
I couldn't have been that thorough. Come on, there's got to be more questions.
Maybe people are shy, but you know what? They have your contact info. It's right there on that last slide, and it's also in the chat box. And if for some reason you lose Cindy's contact information and you need it after the presentation, something comes up, you have a question, you can just call the library and we'll get that information over to you, no problem. Okay, another question has come in. To confirm, can you start using Medicare on the month of your birth, or do you get the card before that?
Well, it depends on when you enrolled. So if you enrolled during your IEP, your initial enrollment period, and you receive your Medicare card, you're always eligible for Medicare if you enrolled during the proper time period, the first of the month of your birthday month. So if you enrolled during those first 3 months prior to your birthday month, you're going to be able to start using Medicare the first of your birthday month. So, for example, if your birthday is in October, your IEP begins in August. July, August, and September is the first 3 months of your IEP. Your birthday month is October. So if you've enrolled during the first 3 months, if you applied, I should say, Medicare is going to begin for you October 1. The only exception to that is, and I'm glad this question came up, if your birthday is on the first of the month, then that's the only exception to the rule. So if your birthday is the first of any month, Medicare starts the prior month for you. So if your birthday was October 1st, Medicare actually begins September 1st. That throws a lot of people off. But that's the Medicare rule.
Wow, Cindy, you're so knowledgeable. Like, you know all the ins and outs. This is great. Thank you so much for doing this.
You're very welcome. Well, you know, it's a tough topic, and I don't want anyone to feel frustrated if they still feel lost, because they're not alone. Again, it's a really tough topic, and you could hear this 3, 4, 5 times and still say, I'm confused. Or maybe you might have picked up some important points now, and tomorrow you say, oh my gosh, I forgot everything. It happens. So don't be frustrated. There's always assistance out there for you, and I'm just a phone call away.
Okay, so it looks like that's all the questions that are coming in. So I think we're going to wrap it up. I'd like to thank everybody for attending this evening. Again, please feel free to give some feedback. You can email us at communityengagement@pmlib.org, or you can give us a call. And Cindy, thank you once again for a wonderful presentation. I really appreciate it.
Well, thank you, Jessica, and thank Danielle and Megan, and thank you all. Thank you again for everyone for participating this evening. I know you probably missed a concert that was on TV from New Jersey. So I applaud you all for wanting to gain the knowledge so that you can make an informed decision about what's best for you today if you're eligible for Medicare now. And know that every year, there may be circumstances that may need you to revisit that. So Again, thank you again for wanting to have this information and to learn. Good night, everyone, and stay well.
Good night. Bye.